All right. Moving on. And this story is a little controversial, and I'd like to get your response for this story, because this story, I feel like I've dabbled a little bit with situations like this, but not at this extent. A Michigan hospital is facing a federal lawsuit alleging racial discrimination by a nurse who says she was told by a patient that they don't want to be taken care of by African Americans, by black people, right? The nurse's name is Tioka Williams. She's a nurse at Beaumont Hospital in Michigan. The way that this whole situation happens is that she was doing her job. She overheard one of the patients say she did not want to be taken care of by a black bitch. Yeah. I'm sorry. She heard her patient say that she did not want to be taken care of by a black bitch, right? Ooh, that kind of hit. Right? Ooh, that's a little much, right? Is this first of all, before we continue, is this patient alert and oriented? Can we get that far first? Okay, because if a patient is confused, they can say whatever, and in fact, they do say whatever a lot of times. And yes, that's rough and it sucks, but if the patient is, or I'm guessing that the patient is oriented, because you don't put a lawsuit on a situation like this if they're not, right? And then Nurse Williams went to go tell her clinical manager, and what did the manager do? She went to go talk to the patient, and then what the manager told the patient is, and she told the patient that she would move Williams and that the patient would not have to see her anymore. Pause right there. Let's pause right there for one hot second. Okay? First of all, as an African American, if a patient says that they don't want to be taken care of by an African American, yes, I'm offended, and I think less of the patient. I think, oh, you're not a good person, whatever. But I move on with my day. Sure, get whatever nurse you want. I'm here to treat patients who actually want to feel better. I'm not here to, be hand over foot. It sucks. It's a shitty situation. But I don't think I would bring a lawsuit if this situation happened. What I think is a problem is that the clinical manager said, I will move the nurse so you don't have to see her. Not, I will switch nurses so you can get a different nurse who will take care of you. She said you don't have to see her anymore. That is a little much. It's a hospital. I'm a nurse. I work here. You're a patient. If I'm walking by the hall, if I need to get something, if you're in a shared patient room and I need to get to the other patient's side, you can't see me? That's when I say fuck off, right? That's when I say fuck off. But it doesn't end there, right? So Williams went and she told Human Resources about the situation, the incident, and was told that the patient requests are honored all the time, and that the next time it happens, she would be taken off the assignment altogether. What is going on? I am so confused about the higher-ups at Beaumont Hospital. Number one, you don't tell a patient that you'll never have to see a nurse again unless that nurse has done something absolutely wrong. If it's just per the patient's request, you say, I'm sorry, if you want to get healthier, you're at the hospital. The nurse works at this hospital. She doesn't have to take care of you, but this is the hospital she works at. She's an employee of ours. We love her. She's here. You look away if you are offended by her black skin. Number one. Number two, Human Resources says you'll be taken off the schedule because one patient doesn't want to see black people, so you take her off the schedule entirely. Maybe I agree with this lawsuit, okay? So Beaumont Hospital has put out a statement saying, well, we cannot comment on the specifics of this case because it is pending litigation. We can say that Beaumont's highest priority is providing a safe environment that is free from discrimination for both our patients and staff, and delivering care with compassion, dignity, and respect. Yeah, that's a nice statement the PR team put together, but those two offenses, one by the clinical manager and one by the HR team, is really shitty. I don't like those responses. Hurt me a lot. I don't like that at all. And that is probably why Williams took this and said, I'm going to, file a lawsuit against you for the racial discrimination. I really don't care as much. And the reason I say that is because I'm here to fix the patient's ailments. If you have heart attack, if you lost a leg, if you're here for chemo, whatever you're here for, that's what I'm here to fix. I'm not here to change your mind on race. I'm not here to make you, because we have nurses that don't want to take care of patients that are transgender. We have healthcare providers that don't like doing abortion treatments. There's a lot of things that make people feel more comfortable or less comfortable. That's number one. And number two, like I said from the beginning, hopefully this patient is oriented, because if the patient isn't oriented, disoriented, then I think this entire thing is just bullshit, and you can't expect someone that's disoriented, yeah, that might be their true feelings or whatever, it might be offensive, but being a nurse, you got to deal with offensive shit when it comes your way. Let me know what you guys think in the comment section below, because I think this is super interesting. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.